There's a simple test doctors are starting to use in clinics that has nothing to do with blood work, nothing to do with scans, and takes less than 10 seconds. It's not your blood pressure, it's not your cholesterol, it's whether you can stand up from a chair without using your hands and sit back down again, smoothly a few times in a row. That's it. But here's the part that surprises people. Some researchers have found that how easily someone performs this simple movement may say something meaningful about their strength, their balance, and even how independently they're likely to live in the years ahead. Most people over 60 never think twice about this movement. They just do it day after day without noticing it's changing. And that's exactly why it matters. Because after 60, the body doesn't announce its changes loudly. It changes quietly in the background long before anything feels different. Today, we're going to talk about that movement and about a small daily habit, just 20 repetitions, that may help support your body in ways that go far beyond your legs. Here's what makes this quiet change important. Muscle strength, especially in the legs, tends to decline gradually with age. Most people never notice it happening in day to day life until a moment when they suddenly need that strength. Getting up quickly, catching their balance, carrying something up a flight of stairs. What makes this particularly important is that this kind of decline can affect more than mobility. Weaker leg muscles may be connected to a higher chance of falls, and falls remain one of the more serious health concerns for adults over 60. The body changes quietly in other ways too. Bone density can shift, balance can become less reliable, blood sugar regulation can become less efficient. None of these changes happen overnight, and none of them are anyone's fault. They're simply part of how the body ages. Ignoring these changes doesn't cause an immediate problem. But over years, small declines can add up, affecting confidence, independence, and overall quality of life. Now, before we go further, I want to be clear about something. This video isn't here to alarm you. It's here to inform you. Understanding how your body changes with age isn't about fear. It's about awareness. Awareness gives you the ability to make informed choices and to have more productive conversations with your doctor. If you currently have joint concerns, heart conditions, recent surgeries, or any condition affecting movement, please don't start a new exercise habit, even something as gentle as this, without checking with your healthcare provider first. And never stop or change any medication or treatment plan without medical guidance. This is simply about understanding your body a little better. What we do with that understanding is always a personal decision made together with your own doctor. My name is Dr. William Lee, and I'm a physician and medical educator. For years, I've worked with older adults on the small, sustainable habits that support long-term health. Not extreme routines, not quick fixes, just clear, evidence-informed information explained simply. That's exactly what we're doing today. If you find this kind of practical, no-nonsense health education helpful, you might enjoy the rest of what we cover on this channel. We talk about the body's quiet changes after 60 and the small habits that may help support health as we age. No pressure at all. But if that sounds useful to you, consider subscribing so future videos like this find their way to you. Now, let's talk about what's actually happening inside your body. To understand why something as simple as a squat matters more after 60, it helps to understand a bit about how aging affects muscles starting somewhere in our 30s and gradually accelerating with each decade. Adults tend to experience a slow, natural decline in muscle mass and strength. Researchers sometimes call this process sarcopenia. It's not a disease in the traditional sense, it's simply part of the aging process, similar to changes in skin or hair. Here's a simple way to picture it. Think of your muscles like a garden. If it's tended regularly, watered, used, cared for, it stays strong and resilient. If it's left alone for long stretches, it doesn't disappear overnight, but it slowly becomes less vibrant. The legs are often affected first and most noticeably, largely because many people spend more time sitting as they get older. Less movement means less demand on the leg muscles, and the body, always efficient, tends to reduce what it isn't using. This is where a movement like the squat becomes interesting. Squatting isn't a modern invention or a gym trend. It's one of the most natural movements the human body performs. Standing up, sitting down, bending to pick something up. Our bodies were built to do this movement thousands of times across a lifetime. The good news? Research on resistance and functional movement suggests that even small, consistent efforts to keep these muscles active may help support strength as we age. That's what brings us to today's main topic. Let's walk through 9 ways a simple daily habit. Around 20 squats a day, done at a comfortable pace and within a safe range of motion, may support the body after 60.1. Supporting leg muscle strength, the most obvious place to start is the muscles themselves, particularly the quadriceps, hamstrings, and glutes. When you lower into a squat and stand back up, these muscle groups contract and lengthen in a coordinated pattern. This is a functional movement, meaning it closely mirrors what your body already does throughout the day. As we age, using these muscles regularly may help signal to the body that they're still needed, which, according to research on resistance training in older adults, may help support the maintenance of strength over time. Practical advice here is simple. Comfort and control matter more than speed or depth. A partial squat, or even practicing the sit to stand motion from a sturdy chair, can offer meaningful benefit without unnecessary strain. The goal isn't to build bulging muscles. It's to preserve function, the ability to get up, move, and stay steady. But that's only part of the story, because stronger legs don't just help you stand. They may also protect something else entirely. Point 2. Supporting balance and fall prevention. Here's where things become more important. Falls are one of the more common health concerns among older adults, and leg strength plays a meaningful role in balance. When the muscles around the hips, knees, and ankles are stronger and more responsive, the body may be better equipped to make small, quick corrections, like catching yourself on uneven ground. Squatting, even in gentle form, engages the stabilizing muscles around the joints. Some research on functional training in older populations suggests that this kind of movement may contribute to improved balance and coordination over time. This doesn't mean squats alone prevent falls. Balance is influenced by many factors: vision, inner ear health, footwear, home safety, and more. But strength is one piece of that larger puzzle, and it's a piece you can actively support. If balance is a current concern for you, it's worth practicing near a wall, countertop, or sturdy chair for support, and discussing any fall risk factors with your doctor. The next point surprises many people because it has nothing to do with muscles at all. Point 3. Supporting bone density muscles aren't the only tissue affected by aging. Bones change too. After a certain age, particularly for women after menopause, bone density can gradually decrease. This is a well-documented pattern in aging research connected to hormonal shifts and reduced physical loading on the skeleton. Here's an interesting detail. Bones respond to mechanical stress. When muscles pull against bones during movement, as they do during a squat, it can create a small, safe amount of load on the bones in the legs, hips, and spine. Some research on weight-bearing activity suggests this kind of loading may play a role in supporting bone health over time. This is not a replacement for bone density screening or treatment, especially for those already diagnosed with osteopenia or osteoporosis. But as a general, gentle form of weight-bearing movement, squatting may complement other bone-supporting habits like adequate calcium, vitamin D, and physician-guided care. This is where everything starts to connect, because stronger muscles and bones also affect something many people don't associate with squats at all: blood sugar. Point 4. Supporting blood sugar regulation, this next point tends to surprise viewers the most. Muscles are one of the body's primary sites for using glucose, the sugar in our blood that comes from food. When muscles contract, especially larger muscle groups like those in the legs, they draw glucose from the bloodstream to use as fuel. As we age, insulin sensitivity, how efficiently the body manages blood sugar, can gradually decline. This is part of why blood sugar concerns become more common in later decades of life. Movement, especially movement that activates large muscle groups, may help support healthy blood sugar regulation. Some studies on physical activity and metabolic health suggest that regular muscle engagement can play a supportive role in glucose management. To be clear, squats are not a treatment for diabetes or blood sugar disorders, and anyone managing these conditions should continue following their doctor's guidance closely. But as part of a broader, medically supervised approach to health, staying physically active may offer a meaningful, supportive benefit. But that's only part of the story, because your heart may benefit from this simple movement too. Point 5. Supporting cardiovascular health, even a movement as simple as a squat, asks something of your cardiovascular system. When you engage large muscle groups repeatedly, your heart rate and circulation respond, delivering oxygen and nutrients to working muscles. Over time, this kind of regular, moderate activity may support healthy circulation and cardiovascular function. This doesn't mean 20 squats replaces cardio exercise like walking or swimming. Rather, it's a complementary habit, another small way of asking the cardiovascular system to stay engaged and responsive. For those with existing heart conditions, it's especially important to check with a physician before beginning any new physical activity. Even something gentle like this, here's where things become more important still, because the benefits don't stop at the heart. They extend into the body's internal chemistry. Point 6. Supporting hormonal balance as we age Certain hormone levels shift gradually, including hormones related to muscle maintenance and metabolism. Physical activity, including resistance style movement like squatting, has been associated in research with modest natural support for the body's hormonal balance, particularly hormones involved in tissue repair and metabolism. This isn't about dramatic hormonal change. It's a subtle supportive effect. One more way movement helps the body function as it was designed to. Think of it as gentle reinforcement, not transformation. Small, consistent signals to the body that movement is still part of daily life. And speaking of signals to the body, this next one might be the most important of all because it involves the brain. Point 7. Supporting brain health. This is where many viewers are surprised the most. Physical movement doesn't just affect muscles and bones, it also affects the brain. When we engage in movement, especially movement involving coordination and muscle engagement, blood flow to the brain increases. Some research has linked regular physical activity to the support of a protein called BDNF, brain derived neurotrophic factor, which plays a role in supporting brain cell health and connectivity. While squats specifically haven't been isolated in large scale studies, general physical activity has consistently been associated in research with better cognitive function and reduced risk of cognitive decline in older adults. Again, this isn't a guarantee. Squats alone won't prevent memory related conditions, but as part of a broader lifestyle that includes movement, sleep, nutrition, and social connection, this kind of simple physical habit may contribute to overall brain health. This is where everything starts to come together because the last 2 points may matter more than any of the others. 8. Supporting joint health and mobility. Joints rely on a natural lubricant called synovial fluid, which helps cushion movement and reduce friction between bones. Gentle, regular movement, including controlled squatting motions, may help stimulate the circulation of this fluid, supporting joint comfort and mobility. This is sometimes summarized simply as motion is lotion among physical therapists. As we age, joints that aren't regularly moved through their range of motion may become stiffer over time. Gentle, appropriate movement done at a pace that avoids pain may help maintain more comfortable joint function. Of course, if you have arthritis or joint replacement, it's essential to work with a physician or physical therapist to determine what range of motion is appropriate and safe for you specifically. And now, we arrive at the final point, the one that ties everything together, joint 9. Supporting long-term independence. Remember the small test from the beginning of this video, standing up from a chair without using your hands? That movement is essentially a squat. And some researchers have used variations of this test as a simple marker of functional strength in older adults because it reflects the coordinated use of multiple muscle groups, balance, and joint mobility all at once. Practicing squats, even gently and at low repetitions, may help support the very capability that allows for continued independence. Getting up, moving safely, and navigating daily life with confidence. This final point brings everything full circle. Strength, balance, bones, blood sugar, heart health, hormones, brain health, joint comfort, they all connect back to one simple, natural human movement. So let's bring this all together. The body changes with age, quietly, gradually, without dramatic announcement. Muscles may lose some strength. Bones may lose some density. Balance, blood sugar regulation, and joint comfort may shift subtly over the years. None of this is cause for alarm. It's simply part of being human and part of growing older. What today's conversation shows is that a small, consistent habit, something as simple as 20 gentle squats a day, done safely and within your own ability, may offer supportive benefits across multiple systems in the body, from muscles and bones to blood sugar, heart health, and even brain function. As always, before starting any new physical activity, especially if you have existing health conditions, please talk with your doctor. And if you're currently on medication or receiving treatment for any condition, never stop or adjust it without medical guidance. This video is about awareness, not a substitute for personalized medical care. The most empowering thing you can do for your health as you age isn't found in a dramatic change. It's found in small, sustainable habits and in staying curious about how your body works. If you found this video helpful, it would mean a lot if you gave it a like and left a comment letting me know which of these 9 points surprised you the most. And if you know someone over 60, a parent, a neighbor, a friend who might benefit from this kind of clear, calm health information, consider sharing this video with them. Sometimes the most valuable thing we can give someone is simply useful information explained without fear. Skur if you'd like more videos like this one, and I'll see you in the next video. Take care of yourselves and take care of each other.